Meal timing has a major influence on our health. Maintaining high levels of glucose over long periods of time can have implications including a higher risk of progressing to type 2 diabetes, an increase in cardiovascular risk due to the damage that high glucose levels do to blood vessels, and increased chronic inflammation, which aggravates cardiovascular and metabolic damage. Until now, it was commonly believed that the primary repercussion of late dinners was weight gain, mostly because people tend to opt for unhealthy, ultra-processed foods at night. However, the importance of this study lies in its ability to demonstrate that the timing of our meals can independently affect glucose metabolism, regardless of the number of calories consumed throughout the day or an individual's weight and body fat level. For their research, the team examined 26 individuals aged between 50 and 70, who were either overweight or obese and had prediabetes or type 2 diabetes. They divided the participants into two groups: early eaters who consumed the majority of their daily calories before evening, and late eaters who consumed 45% or more of their calories after 5 p.m. Despite both groups consuming the same amount of calories and the same types of food, their meal timings were different. Intriguingly, it was found that late eaters had poorer glucose tolerance despite their weight or diet composition. They also tended to consume larger quantities of carbohydrates and fats in the evening. The body's ability to metabolize glucose is limited at night, because the secretion of insulin is reduced, and our cells' sensitivity to this hormone declines due to the circadian rhythm, which is determined by a central clock in our brain that is coordinated with the hours of daylight and night. It's important to recognize how meal timing varies across cultures, as dietary habits differ widely. For example, Mediterranean cultures often have their largest meal in the late afternoon, while Northern Europeans eat dinner early. Adapting dietary advice to fit these cultural contexts can improve its effectiveness. Future research should explore how considering cultural, environmental, and social factors in dietary guidance could boost adherence and results, thereby improving global public health. By understanding meal timing in cultural contexts, dietary recommendations can better fit diverse habits worldwide. Until now, personal decisions in nutrition have been based on two main questions: how much we eat, and what foods to choose. With this study, a new factor in cardiometabolic health is beginning to become increasingly important: when we eat. The path to a healthier lifestyle, according to the results of this study, should include a focus on eating the bulk of our food during daylight hours. The highest levels of calorie intake during the day should be at breakfast and lunch, instead of at tea time and dinner. While more research is needed to explore the implications of this study further, the results thus far provide food for thought on meal timing and cardiometabolic health.